So my name's Jenna, I'm a dual qualified nurse. So I'm general and mental health trained. So I qualified in 2009 as a general nurse and 2011 as a mental health nurse. I've had lots of different placements, lots of different work areas, but predominantly my experience has been around care of the elderly, end-of-life care management, and I've always taken a really strong interest on how we can improve communication, especially around end-of-life care, because I just feel that it's not something that people have many conversations about until we need it. So that was always something that I really tried to make as many improvements on as possible. And yeah, so I've worked as a manager, nurse, student nurse, carer, and I started this kind of thing on Instagram, talking on Instagram in January.
So you mentioned how thousands of public sector workers have reached out to you, including midwives and firefighters. Yeah, I wondered if you could expand on this. Like, how did it start? Like, what kind of response have you been getting?
Yeah, so it started, for me personally, it was around the masks. They didn't make sense to me, like the gaps were too big, there was no seals, the way people were wearing them, dropping them on the floor, picking them up anyway. I wore my mask to kind of make people feel better. However, I went to a circus during one of the lockdown breaks, and a lady pushed me quite aggressively 3 times, and then another lady shouted and was swearing at me because I was sat 1 seat apart from her when she said I should have been sat 2, but that was where the guy sat me, and it just made me think that this is starting to dehumanise people. So for me personally, that was when I started to have a look around what was going on around the behaviour, the communication, the messaging in the media, and I started to talk about it in January because, like many people that have reached out to me, I'm also concerned about, the impact on my income.
Yeah, so you also mentioned that you're only allowed to follow one science. So what is this one science, and what other ones have you come across then?
So right now it feels like, we're told to follow the science, follow the science, follow the science, follow the science. However, as a nurse, we get trained to ask questions, we get trained to be critical thinkers, we get told to, have a look at the research, impartially see where there's any potential conflict of interest from, who is it funded by, because that might kind of like skew the result and things. Whereas right now it seems that if you have any questions around policy, that you're a conspiracy theorist, you're an anti-vaxxer, COVID denier, when actually we've just got questions, and there seems to be a complete lack of debate happening, and anyone who says anything different to the government policy is very quickly discredited. Oh, wow. So it's like follow the science, but not any of the other science, just this one science, and anybody else, regardless of their experience, background, credentials, anyone else is very quickly discredited.
So what would examples of these be? Like what has happened?
So people have lost their jobs, people have had threats, people have been arrested, people have been bullied and ostracised within the workplace, and that's probably the most common one that's happening.
Yeah, because you also mentioned how, when people do ask questions, they are being bullied and silenced to the point of, self-censorship. Yeah, I just wonder if there's, what exactly has been happening.
So I'm not sure when it started. I don't know when we stopped being able to ask questions or kind of speak freely and without censoring ourselves. But an example, nothing to do with healthcare. I was having a treatment the other day, and the lady said that, all the clients are coming in and all saying, "Oh, when are you having the vaccine?" She's saying, "Oh, I've not been called up yet," but she doesn't want it. And I don't know when that self-censorship started, when we couldn't just say, "I'm fit, I'm young, I'm healthy, but it's not for me." but that's quite common. And there's a lot of people as well who are messaging me and their family members are having it, but they're not telling them. And then a couple of weeks later, they're like, oh yeah, I had it on Saturday. And it's very bizarre. I don't know how this has happened, but it seems like people can't just say if they are having it or not having it without some kind of controversy around it.
Yeah, because you also mentioned how staff are being told if they don't have the vaccine, they're going to lose their job. Like, what has been happening then in terms of, you know, like mandatory vaccines and vaccine pressure? Like, how is it kind of manifesting itself in the workplace?
So it's not happening with me, but it is for the thousands of nurses who are messaging me, and there's hundreds that have got in touch with me in tears, who either feel very much pressured and bullied into having it, or have had it and regret having it. And, you know, I'm very much pro-choice, informed decision making, informed voluntary consent, and completely against the coercive practices which are happening. And what it seems to be from the reports that I'm getting is if you say yes, amazing, let's book you in. But if you say no, that decision isn't accepted, you then get 3 text messages, 5 emails, 2 calls from the manager, 1 Zoom meeting with the regional, you get called in for like a re-education session, you then get told that, you know, you might need to redeploy, you might not be able to be patient facing, if you don't have it by a certain date you'll need to leave, and some places are better than others, as in some places are sending this information like written, but a lot of it is kind of verbal, you know, indirect coercion, which isn't being documented, because, you know, as carers and nurses, we're kind of nice, helpful, friendly people that don't necessarily want to cause a scene or want any confrontation, but people are feeling like if they say no, that there's going to be confrontation. So they'll accept the yes, no question, but if there's a no, there's just a big mountain to climb.
All right, so how would you compare then the actual risk in hospitals compared to the immediate hyped risk of surrounding the virus?
So having a look, it seems that lots of it's becoming, you know, hospital acquired, where you have a look at the testing. The media are discussing the cases and the increased cases, but there's no context within that. They're not telling you what a case is, and a case might be someone who hasn't got any symptoms, isn't unwell, but when they talk about the death rates and the increased cases, you know, you almost kind of like put a story in your head of like worst case scenario, but what they don't tell you is the reason why the cases increased was because the tests increased, because they started to test the schools as well as care homes as well as hospitals, and the frequency of that testing, and also it's quite confusing about how they do the rolling data and things. So I feel like they've got a ream of printer paper and they've thrown it out the window, the government, and they've said, look, there's all your information, look how transparent we are, and then people have to really go searching to find it. But it's very, very confusing. And have people got very unwell? Yes. Have people died? Yes. But it seems to be that the virus is being weaponized by the media to scare people, so that we can't talk about other things. We can't talk about, you know, people with dementia, people with cancer, people with eating disorders. We can't talk about other things, suicide, self-harm. Just talk about this virus which is being weaponized. And it's very, very confusing to know what is the perceived risk and what is the actual risk because of the media campaign of fear.
Yeah. So you also mentioned how the culture in the workplace has changed over the last 14 months. Yeah, I was wondering if you could expand on it. Like, how has the culture changed, like compared to what it would usually be like, over the last year or so?
So what's been reported from many different kind of clinical environments is there's a heavy audit focus, so people are becoming very task orientated. So rather having a look at what the patients like outcomes are, and was that a positive one? Did the patient, you know, get involved with that? We're now looking at league tables between hospitals. We're looking to get 100% mark, and we're becoming very fixated on that rather than the actual outcome. The patient deterioration in quality of life. So, you know, if you think about somebody with learning disability or cognitive impairment, and you've now got someone with all these masks and PPE, and they're coming in to do personal care, it's a barrier to communication. So I guess what I would like to see more is, rather than having a huge blanket policy of it's COVID, we need sellotape everywhere, we need like to PPE up, you know, at all times, I would like there to be a risk assessment based on the individual risk of the staff and the individual risk of the people that are supported in that environment. And then the other thing that's changed as well is kind of like the unbearable working conditions, where people are reporting that, you know, they're seeing things that they don't agree with, or the coercive practices. So if they speak out, they're being bullied, coerced, pressured, or they have the kind of like the carrot dangled in front of them and the whip, you know, the stick, and it's kind of like, do this or you'll lose your job.
Yeah, because you also mentioned a GoFundMe page to help nurses who speak out with legal fees. Like, what is happening that you would even need this in the first place? You know, what's been happening there?
Whistleblowers are supposed to be protected. So we've got our, if you're registered with the Nurse and Midwifery Council, the NMC, we should also be registered with a union, so that might be the RCN, Royal College of Nursing, or Unison. There are others as well, but I think they're the most popular that I'm familiar with. And, you know, our places of work should have things in place as well, like processes in place where we're protected, and we should feel safe if we've got any concerns, because we're not going to make any improvements if people don't talk about these things, if we can't learn from them. But what seems to be happening is people are just getting, like, you know, pushed from pillar to post, and then are at risk of losing their job, and it's almost like it becomes a witch hunt then to find out, you know, did you miss a signature, or did you come 10 minutes late for handover, or, you know, and there'll be other things much more serious than that, but it almost becomes unbearable for that person to work there. So many of them leave, many of them are off sick due to stress. So the money from the GoFundMe is all going to the lawyers at Law or Fiction, who are supporting nurses who do speak out and need legal fees.
So what are your plans now that so that people could, for people who are interested in joining in?
So what I'm going to do is I'm going to walk the 69 cities in England, Scotland and Wales, and the kind of short-term win, the quick wins are where if people can connect, people can meet up, people can walk with me, and then they can connect with each other, and then raising awareness in all the different cities of, you know, people asking me questions, asking me what the board's about. And then what I'm going to look at doing is speaking with the lawyers so that we can do a video, so that we can tell nurses, you know, these are the points to kind of do, this is what you should be doing. If you do all those and it still hasn't worked, then speak to the lawyers. And I just want to normalise asking questions. Like, it shouldn't cause conflict, but it feels that because the person maybe doesn't have the answer, they become quite aggressive, and they project all of that anger, and they use all these different tactics to get the individual to be quiet and to shut up, when it doesn't achieve anything, it doesn't improve anything. That person has still got that question, but it's just now inside and not being answered. So yeah, long term, that would be ideal, to normalise asking questions.
Good. And where can people find out more about this?
Yep, so I'm mostly on Instagram, so That Nurse Who Asks Questions. I have got like YouTube, Twitter, TikTok, and Facebook, but it's mostly on Instagram where I am.
Cool. Yeah, we'll put that as a link. And is there anything? Are there any stories or bits of information that you believe people or the public should know about? Is there anything else you'd like to add?
Yeah, so I guess, so I'm not sharing other people's stories. There's little snippets of little people's stories that I do talk about in conversation, but the main thing for me is about supporting nurses to be able to share their own story. And that doesn't have to be publicly, you know, it doesn't have to be a public profile like me. It can just be speaking to the manager, speaking to the regional manager or the unions or the NMC. But what I would say is document everything. You know, create a timeline, have a look through all your policies and procedures, including confidentiality, because it feels like confidentiality has just gone out the window now. GDPR if people are asking for your medical records, any social media policies as well. Have a look at all of those, find out what your rights are, whether that's from your unions, from the Nursing Midwifery Council if you're on the register, and also there's ACAS, which is an employment like support, legal advice, so it's acas.com. And yeah, keep on following me, keep on finding out what I'm up to, and what I'm trying to do is create a community of nurses as well, who are kind of wanting to take action, not happy with what's happening, and then to see how we can support each other, because I think that in order to have a voice, we have to have a face. So, but people, there's safety in numbers, isn't there? You know, it's very easy to discredit me. So yeah, they're the points that I'd say people could do for themselves. Follow me on Instagram to see what I'm up to, and also kind of get involved where we can try and do something together as a group rather than just individuals, because there are other people speaking out as well, but I think that we need to kind of support each other through that difficult time.
Yeah, because you also mentioned it's not just healthcare workers, it's also police officers and firefighters as well. So which I thought was interesting. Like, so I mean, what kind of information have they told you, or what kind of stories have you heard from them?
It's a similar one. It's similar. It's just, so those three categories: heavily audit focus, unbearable working conditions, and so I say detriment to patient care, but if it's a police officer, it might be detriment to you know, whoever they kind of like are interviewing, or their ability to do their own job. So there's kind of slight tweaks with it, or the ability to do their job and support the members of the public, and you know, go to attend calls and things like that. So, but they seem to be the three categories, just changed to each area. And there's also teachers, social workers, counsellors as well, physios, OTs. So yeah, there's a lot, but it feels like there's almost just one within that area, but everybody else is saying that they're crazy, they're unhinged, they're conspiracy theorists. So that really confuses people and they feel quite alone. But if we can support each other and kind of get together, then that's kind of what I'm hoping to be able to achieve as well.
Cool. Jenna, thank you very much. I'm very glad I found you, and I hope to spread this message to as many people as possible. And I feel like you've been a seed, as seeds over there that